The case number 4 is again a patient with a diseased heart because he has had an MI, a post bypass, and he has a severely reduced ejection fraction and is symptomatic heart failure class 2. He presented with palpitation with borderline hemodynamics or BP is 90/60. So what is the rhythm? So you can see narrow complex or wide complex. It's a wide complex. It may be looking at as irregular. You can see this is a rhythm strip, but it can take up except for a few beats. It's apparently regular. So these 2 beats that is coming prematurely, except for this rhythm is apparently regular, but you can still you should be wary of this. So it's a wide complex, almost regular rhythm. Okay. So what is the differential diagnosis? So it's happening in the background of disease. So as I mentioned here, sorry, it's apparently narrow looking QRS. So that's what I told you. Sometimes people will think this is narrow QRS tachycardia. This is apparently looking narrow QRS, but if you see the rhythm in the ECG based on the V lead V1, it is having a relatively wider complex, even though it's looking apparently narrower. And the most important differential diagnosis in the diseased heart tachycardia is VT. So how do you diagnose VT? The only one specific criteria for diagnosing VT based on the ECG is VA dissociation or V more than A. The number of QRS should be more than the number of P waves. Okay, so without the VA relationship, you should be cautious in diagnosing it as a VT. Even though the morphology criteria all suggest VT, think back in the back of your mind that this may turn as SVT with aberrancy. So in the presence of VA dissociation or V more than A, you can 100%, you can 200%, you're sure that this is a VT.